Friends, this is Dr. Rahul Joshi. A couple of days back, a doctor came to me for consultation. He is a middle-aged person, on 43, 44, and his symptoms was that he had increased frequency of urination. He felt fullness in the abdomen and the bladder area immediately after drinking. He felt a lot of load and heaviness in the whole abdomen at large. There was no burning micturition, there was no burning in urination, but there was a lot of fullness, and after the urination there was feeling as if something is remaining behind. This was really bothering him in the mornings because every half an hour, 45 minutes, the patient, the doctor had to go for urination, and the nights were still worse because he had to go every half an hour. It was really bothering him, and he slept almost 3 nights disturbed. Rather, he did not sleep for these 3 nights. So this patient, who the doctor, as I said, renowned allopathic doctor, he came to me and said, Rahul, do you have any medicines to all these things? First of all, I said, so you're a doctor, why don't you get your baseline investigations done? But somehow he has not got his investigation done, not did his urine routine, not did USG to check out any prostatic pathology or bladder or interstitial cystitis or maybe a stone or a urinary tract infection. So no checking was done for whatever reasons, and here we took the case, and the symptoms which came up were bladder fullness sensation of urination after, bladder urination incomplete, bladder urination lying down aggravation, because he said that I can walk but when I lie down immediately the urine comes up, urine scanty, frequent passing of urine scanty, bladder urination, urging to urinate constant. Let me confess, friends, this case was repertorized and studied in detail by a very old colleague of mine, Dr. Kavita Chandramani. And the drug which came up was digitalis, Staphysagria, Heparsulf, and lac caninum, and also lycopodium, the top 6 remedies. But by the process of elimination, by the process of the chilliness and the heat, all these things, also by understanding the nature of the person in short, and using the negative generals and certain symptoms to exclude, we came up with Staphysagria. Staphysagria 200 was given to him 3 doses immediately at night, maybe at 6 o'clock, 8 o'clock and 10 o'clock. And the patient called up and said कि डॉक्टर साहब मुझे ठीक लग रहा है, इवनिंग का जो अर्जिंग यूरिनेट है वो एकदम कम हो गया. I did not pass urine at night, just once, and then when I slept I could sleep properly. After many days I did not get up at night. Now we as doctors do not want to be too happy immediately, and we do not want to be too sad immediately. It's over a couple of days that we assess a patient. But this patient, as I said, an esteemed doctor, felt better and better, and after every day we used to take his follow-up and he felt better, and all these symptoms are abated. This shows that a correctly selected homeopathic medicine really acts wonderfully well. Let me remind you, this doctor also went to a allopathic physician, and that doctor very rightfully had given an antibiotic considering it was a UTI, but even that did not help, and a correctly selected homeopathic medicine with all these symptoms with a repertorization helped him in 1 or 2 hours. That's the reason why in our aphorism number 2 we say rapid. Are you following? Rapid, gentle and permanent. Me as a doctor was so happy that one colleague doctor from a opposite stream, different stream, was helped with our medication. And friends, let me tell you frankly, the credit goes to my colleague, a very intelligent girl who has topped the university in the final year examination, has come with flying colors in MD examination, and also has a beautiful handwriting. She's an amazing doctor. This credit goes to Dr. Kavita Chandramani. Thank you, friends. Homeopathy works wonders when we select the right medicine and when we hit the nail on the head. Coming with proper symptoms is very important. Thank you, friends. Hope this case really motivates all my medical colleagues to tell people that even something like UTI where other streams have failed, or it may be a other bladder problem, whatever it may be. We didn't go in the details of what the pathology was, but symptoms are matching and the patient is better. Thank you, friends.